In terms of diet, there is no lymphedema diet per se, but there are things that you can do to improve your lymphatic health. The first, again, I don't think I said this before, is to drink plenty of water to maintain hydration. The second is to maintain a relatively low salt diet. And the reason why is because when you eat a lot of salt, your body becomes acidic, your blood becomes acidic. And in order to balance out that pH, it's going to want to hold on to more fluids. So you're going to have more fluid retention when you eat a lot of salt. So, just be mindful of that. Another recommendation is to have a relatively high fiber diet. And this is, whatever is recommended by the FDA. And this is because if you have regular bowel movements, you have also increased overall lymphatic health. As I mentioned earlier in the presentation, one part of the lymphatic system is responsible for absorbing fats along the gastrointestinal system. So if you make that work less, then I guess energetically speaking, you have more energy devoted to other parts of your body that are in need of more help. The question was, drink plenty of water. What exactly does that mean? Can you please define that? Does it mean a gallon or does it mean a glass? It's hard to say because everybody has a different state of hydration. If you have been continuously drinking just one bottle of water every day, it's probably more consistent. It's pretty safe to say that you're hydrated, as opposed to a patient who only drinks coffee, let's say, and only sugared drinks. That patient would need a little bit more water. So it all depends on what your hydration needs are. You have to listen to your body again. Some signs of dehydration are decreased memory loss, overall sluggish feeling, overall fatigue, where you just want to sleep all day. If you have chapped lips, if you have dry skin. So there are definitely telltale signs on the body. So you want to, again, just take a look at your body and see how you feel. Because if you're feeling great and you have beautiful glowing skin, then it's likely the case that you are well hydrated. So it all depends. The last thing in terms of diet is to maintain a relatively low fat diet. And the reason why is because significant weight gain, especially into the levels of being obese after surgery, has been shown by research to be one of the greatest indicating predictors of lymphedema, the development of lymphedema. So at the very least, after cancer intervention, you'd like to maintain your weight as is or work towards your ideal body weight. What you would like to avoid is significant weight gain, especially into the levels of being obese. So that's the reason for that. But again, what I'd like to encourage you to do is to have the perspective that maintaining a good weight is just recommended for good overall health, right? By having your ideal body weight or having your ideal body mass index, you also significantly decrease your risk for developing high cholesterol and heart attacks and strokes and things like that.